Okay, hi everyone, we're live. I'm just going to invite Sara Banta if I can figure out how to do this. Okay, here we go. So today we're going to be meeting with Sara Banta. She is the formulator and owner of Accelerate with Patients. I also take them daily, and I'm really excited for her to be on and helping us to explain why these supplements are so amazing. Oh, hi, that worked so easily.
I have never had it work that easily. This is
I actually,
fantastic.
this is my first live, so I'm like, hopefully I can figure this out, but it's perfect.
Yes, good to see you.
So good to see you. I'm so excited. I have all my products lined up. I'm like, let me grab them just so I can show everybody that I do indeed take all these products every day.
I love it, and I do too. I don't know what I'd do without them. And I mean, I thought maybe we should just start with why we need these,
Yes.
right? Um, we're in a different world. And I always laugh at the way God plays jokes on me and puts me through some serious health issues or someone in my family and says, okay, I got to come up with a solution, not just for everyone out there, but for my own family or for myself. And what I've really come to find out is I know the thyroid is the master endocrine gland. I know it controls so much. And I know you got to love your liver. I've always known that. But to a whole nother level is where I've learned over the last year in my own personal experience. And we are in a world with heavy metals.
Mhm.
Post pandemic, we've got the influence of the spike protein that has hijacked the liver. Most people have suboptimal thyroid due to the spike protein, due to the endocrine disruptors, fluoride. And fluoride, RFK is coming out with a new 4-part documentary on
Mhm.
the four toxin big threats of our world, and one of them is fluoride, guys. It's in our waters, it's in our toothpaste, it's
Mhm.
in a whole bunch of other stuff. But then you don't even think about the bromide and the chlorine. Chlorine's coming through
Exactly.
your showers, right?
Oh yeah.
It's in your pool water. And I had a client email me the other day with her long list of symptoms and all of these things going on and what she thought was happening. And then at the very end, she goes, do you think my thyroid issues could have anything to do with me being a swim instructor, being a swimmer in high school and all through childhood and all the swimming in a
Mhm.
chlorinated pool? I'm like, yes. Okay, so that's just one thing. But all of these things are stacking,
Yes,
right?
they are.
And we've got our food supply has been hijacked. 70% of it is processed foods. And those processed foods have ingredients that our body does not recognize as food. So it doesn't know to do with it. It's poison. It's making the liver overwhelmed. The liver's like, this isn't food. This isn't fat or protein or carbohydrates. This I don't know what to do with this. I'm going to just
Yeah.
shove it into my fat cells and for survival. And
Yeah,
so,
the organs that I actually find most on people, especially women, is thyroid, liver, and gallbladder. Even
yeah.
sometimes before the gut. Everyone's so focused on the gut, and obviously the gut is so important. But I find liver and thyroid every single day on women.
And people don't realize that the thyroid and the liver affect the gut,
Exactly.
right? And your digestion has a lot to do with those two things.
Hmm.
I go up and down with my thyroid, so I'm super sensitive when I'm hyper or hypo. And when I go hypo, water retention, can't pull my rings off my finger. I feel like my hair is limp and falling out,
Totally.
but I'm constipated, and my digestion feels like it's sluggish.
Yes. Thank you for bringing that up because that's one thing that a lot of people don't know is that constipation is actually a sign of a low thyroid.
Yes, and liver. And so the liver is a huge part of that digestion too, because the
Mhm.
fat and the protein get metabolized in the liver. So back to my little personal story, this last fall, hit by spike protein,
Mm.
other viral activation, parasite infection, worms coming out of my skin. super disgusting. Never wish this upon anybody. However, I'm hearing a lot of these stories from people because of the pandemic and what the spike protein has triggered.
Mm-hmm.
So, with that being said, my system was on high alert. It was under stress. It's the immune system's going, I've got a lot to deal with here. The liver's under stress because it had a lot to deal with. And on my blood test, my liver enzymes were through the roof. My T3 was on the floor. My
Mm-hmm.
testosterone was down, and I usually don't have an issue with that. So all these things are out of whack. And I had practitioners say, "Oh, you just need to take free T3 medication. You need to be put on testosterone. You need to do all this stuff." However, the body's smart. It's in an adaptive response to a current threat. So when I remove that threat, when I get my body back into homeostasis, the numbers should come back up naturally, right? So when this all happened and my liver numbers were through the roof, I came out with, coincidentally, accelerated liver care, knowing, and I had carried a liver supplement on my website for years and years. It was the right?
Mm-hmm.
But it wasn't doing the job.
Yeah.
And so we came out with accelerated liver care, and within 2.5 weeks, my liver numbers came down. It was unreal. I shocked myself, and we will go into the ingredients later on. However, then I felt my thyroid come back on.
Mm-hmm.
Um, Through this whole thing, you've got iodine, and people think of iodine as just a supplement for thyroid, which it is for thyroid, but it's not just for thyroid.
Totally.
They're they used iodine for the Spanish 1918 flu pandemic,
Mm.
right? Because it is antiviral, it's
Yeah.
antibacterial, antifungal, antiparasitic. During that skin breakout that I was having, you better believe that I was putting the accelerating iodine with the accelerated castor oil on
Mm-hmm.
my skin and doing packs over my liver and over the infections and the breakouts,
Yeah,
and it
I
would calm down.
You were the one who mentioned to mix those two, the iodine with the castor oil. And so I've been having patients put that on their breasts if they have
Yes.
like fibrocystic breasts or on the liver, and they've been having incredible results. So,
Yeah, and in my family, we've got one member that has went through a horrible situation with her hormones, and we're seeing a lot of this with the young girls. Their PMS symptoms are horrific.
yeah.
With the 20s to 30s to 40-year olds, fertility is an issue. With the older women, we've got menopausal symptoms becoming worse. Estrogen dominance is skyrocketing. And then not just for women, but for men too.
Hmm.
But for the women, the fibrocystic breasts, the fibroids, all of that. Well, you do that pack with the accelerating iodine and the accelerated scalar castor oil over those fibroids, over those tissues, even over your thyroid for thyroid nodules, you will see a difference, and they will shrink, they will break up, and it's been a game changer for a lot of people. So taking it orally and getting it through topically, your skin is your largest detox organ, and people don't realize your skin is a window into what's going on to your health, a
Hmm.
window into your liver health, because your liver is the number one detox organ. But when it's overwhelmed, guess what is going to happen?
Yep.
Things are going to start coming out of your skin. And those skin rashes, the rosacea, the psoriasis, the acne, it's telling you, hey, my liver can't do anymore. You got to help me out. And it's going to start coming out. So back to what we're under. We've got the processed foods, like I was telling you.
Hmm.
And I just read a study. Texas is coming out with a bill talking about how some of these ingredients are not fit for human consumption. They include your sports drink, the Gatorade, the Oreos, Doritos, all these foods that are put in kids' lunches are are not fit for human consumption. I mean, really? Right? So you've
Scary.
got you've got that, the spike protein, like I mentioned, but then the other thing is that iodine deficiency.
Yeah.
96% of the United States, if not more, is iodine deficient. So we've got iodine is depleted out of the soils like all the minerals, right? So we've got iodine that is no longer in our food supply. If we were eating healthy organic food, most people are eating the
Yeah.
processed foods. But then we also have an increased need for iodine because iodine is going to help with that antiviral, all the pathogens like I talked about. It provides that the 3 and 4 for the T3 and T4 thyroid hormones. You cannot have thyroid hormones without
Mhm.
iodine, right? So it's helping with the thyroid hormones. However, also you've got more iodine receptor sites in your breast tissue than you do in your thyroid.
I didn't know
So
that.
yes, Dr. Brownstein, the OG of iodine deficiency, said that most all of his breast cancer patients
Mm.
were high in bromide in those breast tissues and iodine deficient.
Wow.
Super simple, right? Just start supplementing. So it helps with the breast tissue. It helps with the mental health. The number one cause for depression, iodine deficiency. When you go in to get your antidepressants, your doctor is not testing your thyroid. Most people who get their thyroid working again with the accelerated iodine and the accelerated thyroid, they are able to get off their antidepressants, their
Mhm.
anti-anxiety drugs. And who is not having anxiety or depression in
Oh my God.
today's world, right?
Totally. Can you explain also the powerful detox effects of this? Because
Yes.
my experience with iodine was a lot of energy. So I started taking it in the morning and I immediately felt like I drink a cup of coffee and I'm very sensitive to caffeine. So I don't typically do coffee. But the other thing that I noticed, and it's funny because on the bottle it tells you to slowly dose up. There's a reason for that. And I would love for you to kind of explain that reason. But I sometimes am a little extreme and I like to do high doses of things. So I did a pretty high dose of the iodine for a couple days and I was feeling good. And then all of a sudden, I got so puffy. And I typically like can handle a lot. I can do parasite cleanses. I can handle a lot, a strong dose of herbs. But I blew up and I was like, it can't be the iodine. Like, but that really was the only thing that I had changed. And so I think I had texted you and asked. So I'd love for you to explain the powerful detox effects of the iodine and then also maybe what people can take with it to help with that.
Yeah. So as it's going, every cell has iodine receptors on it. We've got our cell membrane, and the brain, that is the brain of the cell, and it allows nutrients in and it allows the toxins out. Well, that brain of the cell has iodolipid value, iodine fat value. You need iodine to make that cell membrane flexible. Well, if your cell
Mhm.
membrane is so
Oh, can everyone else hear her? Because I just lost the voice.
there, is that
There
better?
we go. Yeah, there we go.
I don't
All
know.
right.
So,
Rewind a little bit.
okay. So the cell membrane allows the toxins out and the nutrients in. And if that cell membrane does not have iodine, it becomes very stiff. And these toxins are just going to be stored in the fat cells to get it out of the blood and to kind of put away and for survival mode, right? So when you supply the cell membrane with iodine, that's going to give this flexibility to the cell membrane. And the toxins are now going to be able to be released into the body, into the bloodstream. Now, you are going to have some detox flu symptoms like you would with a parasite cleanse or a candida cleanse or a die off of any sort. That's because these toxins are reintroduced into the bloodstream and you've got to flush them out. I remember when I went through a heavy metal chelation detox, and my initial levels were extremely high, but halfway through the detox I got retested and the blood amount was higher because
Mm-hmm.
they all started coming out my body, and on the test it showed that they were higher. Obviously it wasn't, because they were just starting to be released, right? So with that cell membrane, you are letting the toxins out, and now you're able to let the nutrients that you're getting, a little bit of nutrients from the little bit of nutrients you're eating, back into the cells. But you also need that iodine for the mitochondrial health, increasing that ATP within the mitochondria. The increased ATP is going to help your body say, hey, I have the energy to start getting rid of some junk here. I've got some energy to increase my thyroid and to start kicking out the toxins out of my thyroid. I've got the energy now to flush out the toxins out of my liver, and to balance out that estrogen dominance that has overtaken me. But all of those toxins now have to be filtered throughout the body, and you want to get them out. So what do you do? Well, you start slow so that your body can slowly flush them out. But you can also use the accelerated ancient salt, which is a 62 mineral unrefined salt enhanced with scalar frequencies, and tastes amazing, by the way. There's no salt that tastes better. I actually was at a girls' dinner the other night, and I pull out my little salt, and this girl next to me is like, what's that?
Mm-hmm.
And I said, well, I can't use regular salt anymore. It just doesn't, it tastes like plastic. So I've got
Mm-hmm.
it. And she tasted it and she goes, I understand now why. Um, so not only does it taste good, but it plumps up the blood to flush out the toxins.
Mm-hmm.
A really quick, easy way, if you're getting a little nauseous, not just from the iodine, but from any cleanse, just putting the salt on your tongue will take that nausea away. It also helps with the gallbladder and the liver to break down undigested fats.
Mm-hmm.
Like you mentioned, with the most women having gallbladder and liver issues, they're not processing their fats. And so the salt can help break that down. Now, they need the accelerated liver care.
Yeah.
Right. If you are getting nauseous from your food, you are not assimilating your fats. And then you're on a high fat, low carb diet, that's really going to backfire. So a lot
Mm-hmm.
of people say that didn't work for me. Probably didn't work for you because you are not assimilating your proteins and your fats because your liver is overloaded. And that was another thing that I noticed when my liver was overloaded. I had to be on an extremely low fat diet
Mm-hmm.
temporarily. I also was losing muscle. Why was I losing muscle? I was eating 200 grams of protein a day, way more than my needs. And what was happening though is my liver could not assimilate the protein. It could not break down it into amino acids and use it to rebuild my muscles, my hair, all the tissues. And my liver also couldn't break down fats. It was
Mm-hmm.
overwhelmed. So you've got to have healthy liver health in order to be able to assimilate the nutrients you're taking in. But then also your liver is, when we're getting off onto liver now, and I'll come back to the iodine and the
Mm-hmm.
thyroid. The liver is where that T4 inactive thyroid
Yep.
converts into T3. Right. So if your liver's overwhelmed and you're to say you're taking thyroid medication, and
Yep.
this happens a lot.
Very common.
Okay, so all hormones are fat based. Well, we just talked about the fact that the liver has to process fat. So if you're taking a testosterone hormone, if you're taking thyroid hormone medication, if you're taking progesterone,
Mm-hmm.
your body, your liver is not going to be able to use it. It's actually going to back up your liver even more, make you feel worse, make you feel nauseous. And this happened within my own family. We needed to increase the progesterone. So a doctor said, oh, let's put her on progesterone. And she got so nauseous, couldn't
Yep.
eat, couldn't drink. And it was because we didn't get to the root problem, which was cleansing the liver, doing some antivirals, making sure we're taking care of that because it was spike protein related. And
Question with the liver, because I love the liver. I take it religiously. I put a patient on the liver and the thyroid, and she had a similar experience where she also gained a ton of water weight. So obviously she started detoxing pretty hard. But I think what was her problem was that the gallbladder was a little sluggish. So we put her on like a gallbladder thinning protocol as well. But I'm wondering if the salt or your other powder, the cellular detox
Yeah, the
powder,
detox
could you
powder.
touch on those? Because
Yeah.
it's rare that this happens, but there's a select few people, myself included, that when they start really detoxing the liver, they blow up and have a bunch of water weight. Not really the flu detox symptoms, but just like a ton of water retention. Can you
Yeah.
touch on that?
Well, you have to think about what is water doing? It's trying to plump up the
Mhm.
blood in the water to flush everything out, but you need
Right.
something to flush it out. The accelerated cellular detox powder has triphala, activated charcoal, tricot, and some other organic ingredients, slippery elm. I'm missing something here. Diatomaceous earth and zeolite. Thank you. Nano nice size, so very nano small. It can bind all of the toxins gently, pull the toxins away from the liver so it takes the burden off the liver and the kidneys and flushes it out. And
Mhm.
oh, and it has chitosan in it, which is known to help take the excess dietary fat and cholesterol out of the body as well. So it used to be when we were kids, it used to be a weight loss ingredient
Mhm.
because it would take that excess dietary fat and cholesterol out of the body. So with that, I do a big scoop at night, every night, and I love it. Bowel movements are amazing with it. And if whether you run constipated or have diarrhea, it will balance it out. In Ayurvedic medicine, we call it the doshas. It balances out the doshas so that your body is regulated, reduces inflammation, helps with colitis, Crohn's disease. It is the number one supplement to be taking. Well, I shouldn't say number one. You need the silver, and you need the iodine when you're traveling, because
Mhm.
if you get food poisoning or you don't know where your food's coming from, that detox powder is your saving grace. But it soaks everything up and it takes it out of your body, and it will help with that water retention as well. So
Okay.
the salt, you think, well, if I'm bloated, I don't want to take any salt. This salt is helping that intracellular hydration inside the cells.
Mhm.
The bloat and the water retention that you're talking about is the extracellular water. So we don't want that. That's inflammation. So those
Mhm.
two are magic in helping with the detox flu symptoms.
Oh, that's awesome. Thanks.
So back to the iodine, it
Mhm.
helps with the estrogen dominance. It's that building block for the thyroid hormones. It helps with that mitochondrial health. The number one cause of death is
Mhm.
mitochondrial failure. The
Mhm.
number one cause of mitochondrial failure is iodine deficiency. So
Mhm.
the sodium potassium pump in the cells requires iodine to maintain that cellular energy balance and to produce that ATP inside the cell. And something else that I noticed when my liver and thyroid were not working, my blood sugar was up, my
Mhm.
cholesterol was up, my ferritin and iron were high. Why? Because my liver was not processing and regulating the cholesterol levels, the blood sugar, and the high iron and ferritin levels. So when you have low ATP and low thyroid, low iodine, you have poor glucose metabolism, which then is going to lead to insulin resistant. How many
Mhm.
people come to you saying, I don't understand. I have insulin resistance. My A1C is higher. I have not changed anything. I
Yep.
don't eat junk. I don't eat sugar. And that's part of it. And then you've got the fluoride, the bromide, the chlorine. So the fluoride we talked about. What happens is if you're deficient in iodine, those iodine receptor sites are going to get filled with the fluoride, bromide, and chlorine that look like iodine. Go back to chemistry class,
Mhm.
right? And you've got the halogen column, and they all look the same. And this is called halogen displacement. So when you don't have enough iodine in those cells or in those little receptor sites, these other halogens, the fluoride, bromine, and chlorine, are going to displace the iodine in the thyroid and throughout the whole body in all of the cells. Fluoride mimics that iodine and it blocks the proper hormone production. The other thing to know is that on your thyroid blood test, that T4
Mm-hmm.
could be falsely 4 molecules of bromide. So you could get
Mm-hmm.
a false number on your blood test. And the iodine also helps with blood sugar. It improves the pancreatic function. It supports that adrenal thyroid pancreas connection. And another thing to remember is that your adrenals, when they're taxed, when you're under chronic stress, which who isn't in this modern day world, right? Your adrenals need more iodine and more salt.
Mm-hmm.
So that's why you might be craving those salty snacks when you're under stress, because your body needs more salt to make more of those stress hormones. Um, the iodine helps balance the estrogen and insulin in the body as well. Excess estrogen blocks thyroid hormone function,
Mm-hmm.
which contributes to the insulin resistance, which contributes to fatigue and weight gain, all those things. Um, and why is acceleradine the iodine? Maybe you have those heavy detox symptoms with the acceleradine. You're like, wait a second, I'm taking the same amount I was taking from a different iodine, and all of a sudden I feel
Mm-hmm.
a difference. Well, it is unlike any other iodine supplement. It is monoatomic, meaning it's one single atom of iodine. And that single atom is going into the body going, I want to find a place to park right now. I don't need to be broken apart by the body, which most other iodines do. If you're on a Lugol's formula or a sea kelp, the problem with those is our waters have been contaminated. Fukushima has radio contaminated most of the sources of iodine. Okay, so most sources come from the Asias. Acceleradine iodine comes from South America, untouched by modern man, untouched by any toxins, any radioactivity. That's number one. But the Lugol's or sea kelp, they're two different compounds that need to then be broken apart for the body to use the iodine. So you get about 10 to 20% absorption. Now, the other problem is a lot of even nascent iodines that have high bioavailability come from or are paired with either an alcohol that is diluted
Mm-hmm.
or not organic or a glycerin that is thick and sticky. I mean, you try to put glycerin on your skin, right? It's sticky, it's messy, you
Mm-hmm.
don't want to do that. Well, the glycerin and anything less than the 200 proof alcohol that we use with the acceleradine is going to lower that bioavailability of the iodine into the cells. So we use 200 proof non-GMO organic alcohol paired with the monoatomic iodine, and it has close to 100% bioavailability, not just for the thyroid, but for the brain, the body, every single cell in the body. And then, of course, we enhance it with the scalar frequencies like all of our supplements. But that
Can you
is the
touch
thing.
on that a little bit? Because that is so unique, and that is part of the reason why I love your supplement line is because they're all scalar frequency enhanced. Can you just
Yeah.
explain a little bit what that means for people?
It's a concept that is a little far out there. However, if you think about prayer, okay, so or versus radio frequency. I turn on the radio in the car and there's a little bit of a delay from the radio station to my car, right? And sometimes you'll hear that feedback if you're on speaker or whatever. When you pray, and I have a friend in Australia and I pray for her right now, it's immediately there. It's like the rope is pulled tight. That is scalar frequency. Scalar frequency is the homeostasis of the world, what it's supposed to be, that energy that is just perfect and the way it is, just that everything is in homeostasis. What we do, and what does that mean? So with every supplement, we will enhance it with scalar frequencies for the purpose of that supplement. So for the acceleradine iodine, it is meant to help um, enhance the detoxification of all the cells and help with metabolism increasing ATP. With the accelerated liver care, you've got frequencies that open up the meridians to the liver and gallbladder that says, okay, I know where to go. I'm going to go straight to the liver and the gallbladder, which, by the way, the accelerated liver care hits that gallbladder and helps start breaking up those gallstones as well, and even kidney stones. There's ingredients in there for the kidney stones as well. So you're getting it all, and you're getting that TUDCA that is going to help with the bile flow and getting things out. The accelerated thyroid. The accelerated thyroid is not just glandular, freeze dried from New Zealand, the only one that we trust, but other amino acids and ingredients that help support and restore thyroid health. So this is good for anybody out there, whether you're hyper or hypo. It's restoring your thyroid, and it's enhanced with scalar frequencies to restore that thyroid, to detox the thyroid from the halogens and put it back into balance with the parathyroid.
And the
So
thyroid and the iodine are both pregnancy and breastfeeding safe, right?
yes.
Okay.
And actually, the iodine is absolutely needed
Needed.
for those pregnant women and the children and the babies, because it is, you go through more apoptosis, which is the turnover, cellular turnover, and new cell production during pregnancy and those teenage years through puberty. So when you ask, well, God, my teenager is acting so awful, depressed, anxious, won't talk to me. They're going through so much change, so many hormones, and they're deficient in iodine. So
Mm.
that iodine is going to help balance their mood, detox their brain, and make your relationship better with them. So
I'm
really,
so glad that you said that because I've heard you talk about iodine a lot and I've known a lot of the different effects of it, but that is something that I see so often, especially with teenage girls, right? Because they're going through so many hormonal changes and
yes.
iodine is so huge when it comes to the hormones. So I'm glad that you said that because that's so important for parents to know because they'll recognize like something is wrong with my kid from like a behavior standpoint, but it's not really like a character issue. It's typically their hormones are off, they're deficient in iodine, so many things are changing.
Yeah. And we are in this generation where parents don't know what to do. They're kind of afraid of their children. And so they just send them to the doctor. The doctor has 15 minutes with them and they put them on an antidepressant, anxiety, or a birth control.
Yeah, which
And right? I mean, I know so many young girls that are not sexually active that are being put
mhm,
on birth control just for the period pain and the menstrual cycle pain
mhm,
and the mood swings, and the parents don't know what to do with their kids, which is
mhm.
so unfortunate.
Yeah, totally.
And I've gone through it. I have two daughters. I know what it's like. And
Yeah,
so if it doesn't work in my household, you better believe I'm going to find a solution. And these
totally.
have been game changers. So just to wrap up, the acceleradine iodine is detoxing your body. It's feeding your thyroid, boosting your metabolism. It's super important for fat oxidation, for protein muscle synthesis. So you can't build muscle without iodine,
Mm,
and it's helping cleanse the blood so the liver can do its job, right? Then you've got the accelerated thyroid to back it up to restore the thyroid function naturally. So many people are on thyroid meds and they feel worse, and then
mm,
they switch to the accelerating iodine, the accelerated thyroid, and they're able to get off their medication with the guidance of their doctors, of course. um, but that's supporting the thyroid. And then the accelerated liver care is cleansing the blood, breaking down the stones, actually has ingredients to help your hair growth, which I know a lot of women are suffering from hair loss. And thyroid, if you have low thyroid, you're going to lose your hair too. When you talk about the causes of hair loss, spike protein, iodine deficiency, and liver. Those are the three things. Then we can add in the collagens and the shampoos and all of that stuff. But you
Yeah.
got to get down to the basics first.
So
But
for
the
nothing else, the trifecta would be amazing for hair growth. I'm just kidding.
exactly. Exactly. And then the liver care is also helping with your protein and fat metabolism and helping with the conversion from that T4 to T3. That's the active thyroid hormone so that your body actually has a metabolism, can burn fat. I don't care how many Orange theory classes you go to, how little the calories you're eating, you are not going to lose weight if your liver's not functioning and your thyroid's not functioning. So there's so many more benefits to all three of them. But really, when you address thyroid and liver, a lot of the other issues start going away. The insulin resistance, the weight loss resistance, the inflammation. And then we talked about the salt and the accelerated detox powder kind of as those backup, cleanup, sweeping, let's get everything, all the junk out. You start getting your energy back. And with what I've gone through, which I don't wish upon anybody ever, these three supplements were game changers through my experience.
Yeah, thank you so much. This was amazing. You are such a wealth of knowledge, and I'm so glad that you have so many incredible supplements, but I really am glad that we chose to talk about these three because they are such game changers, not only for me, but I've seen with my patients as well. When I put people on this trifecta, the labs change, their symptoms change, all the downstream things, right, that people are focused on treating, like the adrenals, the insulin resistance, all of that starts to resolve when
Yeah.
you're addressing these two pieces. So thank you so much.
Oh,
Also, do you know if this is saved? If I just exit out, or do I have to do something to
yes.
save it? Okay,
I
perfect.
think
So
so.
I'm going to save this and I'm going to repost it for everyone who wasn't able to join the live. Thank you so much, Sarah. I would love to talk more about your supplements in the future because I know
Absolutely.
these are huge pieces for people where if they listen to this, something you said is going to be like, oh my gosh, that's me. Or, oh, I know someone who has this. Like everything you talked about is so relevant. And these supplements, like I've experienced, they're so powerful. They work sometimes too little too well because they're so strong, but that's what we want, truly. They work phenomenally well. You source everything from the highest
Yeah.
sources. And so I trust your formulas and everything that you've done with them, and they really are incredible. So thank you.
Well, thank you. And I'm happy to come on if people have questions, we could answer the
There
questions.
was actually one question before I end this. Is somebody asked, I'm pretty sure I know the answer, but I'll ask you for 2 to 7 year olds, like so toddlers, really young for the iodine. What do you do in terms of dosages, or how do you do that for like toddlers?
First you're going to start slow. What's interesting though is with kids they don't have as many toxins in them, so the detox symptoms they're not going to have.
Mm-hmm.
But I do keep the dosage to, start slow but work up to 10 to 15 drops 3 times a day.
Oh, wow. Okay, great. Yeah, so that's anywhere like under 10, you would say, or even younger.
Yes.
Okay, perfect. Awesome. Okay, thank you so much. Thanks
Thank
for everyone for
you.
joining. Okay, bye.